Hi, my name is Jaclyn Juarez, and I had a phone interview with Megan Tran, and her preceptor is Darren Klons, and they work at Cigna Medical Group Chandler location. So the first question I asked her is what a typical day looks like for Darren, the pharmacist. And so Darren is a diabetes management specialist, and he works under a collaborative practice agreement. So what happens is the physician will send a referral to Darren, and the patient will come in and he'll do a comprehensive medication review. He'll talk about things they've done in the past with their diet, their exercise, any struggles they've had, and then he'll get a complete picture of the patient and then come up with a recommendation and send that to the physician. But they also do consultations over the phone as well, so it's a little bit of patient interaction in person and also over the phone. And the clinic is open from 9 to 5. So currently he's only doing diabetes management, but he's also looking to expand to maybe COPD management in the future and other different projects. Darren also covers 3 locations, one in Tempe, one in Chandler, and one in Gilbert as well. So Darren didn't do a residency, but she was mentioning that a lot of the new pharmacists that were coming in have residencies, so she thinks it might be a requirement coming up in the future. And she also mentioned that Darren has an MBA, so she thought that was really beneficial for the management role that he holds. So for Megan, she basically does the same thing. She'll call 70 patients a day and try to do those comprehensive medication reviews, answer any questions they have. She did mention a lot of the patients come in with questions about the Freestyle Libre meters, which check the blood glucose levels. And she mentioned that a lot of the doctors don't even know how to use it. So she thought it was really cool how she's able to counsel patients and help them with something that they're going to use every single day. So another thing that she's done is converted to an electronic health record. So she puts together a comprehensive training guide for all of the new people that are going to come in on their appies, which is really cool. So she did mention on the second week she called over 70 patients who were considered the most vulnerable. That includes people with hospitalizations, higher cost medications, and people with lots of chronic disease states. She does the same thing. She does the CMR over the phone. She goes over the medications, looks at drug-drug interactions, so she's able to practice her clinical skills and also the patient skills at the same time. So the main focus is on diabetes, but they also cover congestive heart failure, AFib, and other things. So she just thought it was really cool that you're able to counsel the patients, look at their medications, and she's made recommendations to Darren that he sent over to the physicians that they've loved. So she really likes that. She did mention it was a little bit challenging because this rotation is not as structured as the other rotations that she's been on, so sometimes she has to fly off the seat of her pants and kind of improvise things, but she did mention that is going to make her a better pharmacist in the end. So some of the projects that she works on, she mentioned that they're a little bit different from her other rotations, where you present to many people. She just presents to Darren, and he'll give her a topic to do one on based on maybe something she spoke with a patient, such as pancreatitis one week. So she had to make a presentation about a patient case, how it was diagnosed, treatment options, and other drug information and stuff like that. And she mentioned with those presentations that it's important to be succinct, and it's not going to be like these long presentations. She said bullet points were good to put rather than just listing off a whole paragraph. So she gave me a lot of good information, and it was really great being able to learn about what she did. So I think I would want to do that in the future. It kind of sounds like what I did at Symphonia, doing comprehensive medication reviews over the phone. So I really think I want to try it in the future. She really thought that she could see herself working there, so it was a good experience overall.